Here is something that genuinely surprises me every time I think about it. Iron deficiency is one of the most common medical conditions on the planet. It affects roughly 1 in 4 people worldwide. In the UK and across much of the developed world, somewhere between 1 in 5 and 1 in 3 women of reproductive age are running low on iron at any given moment. That is not a rare condition. That is an epidemic hiding in plain sight. And yet the vast majority of those people will never be tested. They will never receive this diagnosis. Because the symptoms are so easy to blame on something else, stress, poor sleep, being too busy, getting older, that the real cause never gets found. Here's what I want you to understand before we go any further. I have been working in emergency medicine for 13 years, and I see signs of iron deficiency on almost every single shift. Not always as the main reason someone came in, but there, in the blood results, quietly sitting in the background, having caused problems for months or sometimes years without anyone catching it. And I would be willing to bet that most people watching this video right now will recognize at least one symptom from the list we are about to go through. Not because you definitely have iron deficiency, but because these symptoms are so common, so easy to dismiss, and so rarely connected to their real cause, that the chances are high you have felt at least one of them and put it down to something else entirely. So stay with me, because by the end of this video, I am going to give you 2 things. First, the exact signs your body uses to tell you your iron is low, and why each one happens biologically. And second, precisely what to do about it, including the exact blood tests to ask your doctor for by name. That second part is the part most health videos skip. We are not skipping it. My name is Dr. Miles, 13 years in emergency medicine. And just so you know, it is just me behind this channel. No team, no production company, no corporate backing, just a doctor who believes that people deserve to have this information long before they end up needing emergency care. If this video helps you or someone you love, then the single best thing you can do to support what I am trying to build here is hit the subscribe button. Only about 1 in 4 people who watch these videos actually subscribe. If you are finding this useful, please be one of them. It takes 2 seconds and it helps this reach the people who need it most. Now, let's talk about iron. The mechanism. Why iron affects everything. Before we get to the signs, you need to understand one thing, because it explains why iron deficiency causes such a wide and confusing range of symptoms across completely different parts of your body. Iron sits at the center of hemoglobin. Hemoglobin is the protein inside your red blood cells that carries oxygen from your lungs to every single tissue in your body. Without enough iron, you cannot make enough functioning hemoglobin. And without enough hemoglobin, every cell in your body starts running short of oxygen. Think of iron as the fuel loader at an airport. The planes, your red blood cells are ready and waiting. But if the fuel loader is not doing its job, nothing takes off properly. Every destination, your brain, your muscles, your heart, your skin, gets less than it needs. Now here is the myth bust moment that most people have never heard. You can be iron deficient and still have a normal hemoglobin level on a standard blood test. Your body burns through its stored iron, measured by a test called ferritin, long before the hemoglobin itself drops dangerously low. So unless your doctor specifically orders a ferritin test, the deficiency can hide in plain sight for months or years, even with routine blood work being done. This is exactly why it gets missed so consistently. The standard test does not catch it early enough. Iron also plays a role in your immune system, your hair, your nails, your skin, and in the production of brain chemicals that regulate your mood, your focus, and your cognition, which is why the effects of low iron spread far beyond what most people expect. Let's start with sign number 1. Sign number 1. A tiredness that sleep does not fix. This is by far the most common sign I see, and it has a very specific quality that separates it from ordinary tiredness. Normal tiredness responds to rest. Iron deficiency fatigue does not. Patients describe it as a heavy, dragging exhaustion that sits with them all day, every day. They go to bed tired, they wake up tired, they rest all weekend, and on Monday morning they feel exactly the same. The reason is straightforward. With less hemoglobin in your blood, your muscles and your brain receive less oxygen than they need to function. Every task, physical or mental, costs more than it should. Your body is working overtime just to keep up with normal daily demands. What I see repeatedly in the department is people who have been pushing through this kind of fatigue for months, sometimes years, blaming it on work, stress, or parenting, or just life, when the entire time it was something a single blood test could have identified and fixed. Sign. Number 2, breathlessness. Doing things that never used to wind you. Climbing one flight of stairs. Walking up a gentle slope. Carrying shopping from the car to the kitchen. Things that used to feel effortless suddenly leave you needing to stop and catch your breath. The mechanism is the same as the fatigue, but more visible. When your blood cannot carry enough oxygen, your heart and lungs compensate by working harder. Your heart beats faster. You breathe more rapidly. Your body is trying to deliver what it can with what it has. People often notice this first during exercise. They feel like their fitness has fallen off a cliff for no obvious reason. They assume they are out of shape or getting older. Sometimes that is all it is. But sometimes, particularly if this has come on over weeks or months, it is a quiet drop in iron stores that nobody has thought to check. Sign number 3, paleness in places most people never look. When hemoglobin levels drop, the rich red color it gives to your blood and your tissues fades. And there are specific places on your own body where you can check this yourself right now. Pull down your lower eyelid gently. The inner lining, the conjunctiva, should be a healthy reddish pink. If it looks pale or almost white, that is a meaningful sign worth taking to your doctor. The same goes for the inside of your lips, the beds of your nails, and the palms of your hands. Now, I want to say something important here. These signs are significantly harder to spot in people with darker skin tones, and that is one of the main reasons iron deficiency is missed more frequently in people from African, South Asian, and other non-white backgrounds. The medical textbooks most of us train from are not representative of the full population we serve, which is why if you have darker skin and you are experiencing the other symptoms on this list, you need to push for a blood test rather than relying on a visual check. Do not let a doctor dismiss your symptoms without testing you properly. You deserve the same standard of investigation as anyone else. Sign number 4, hair that sheds more than it should and nails that break. Iron is essential for the rapidly dividing cells that produce both hair and nails. When your stores run low, your body makes a ruthless decision. It redirects whatever iron remains to the organs it cannot survive without. Your heart, your brain, your muscles, hair and nails get deprioritized. They are not essential for survival. The result is hair that sheds in larger amounts than usual, noticeable in the shower drain, on the hairbrush, sometimes in clusters, and nails that become brittle, thin, and prone to splitting. In more severe deficiency, you can develop a condition called koilonychia, where the nails actually curve inwards and spoon at the edges rather than arching outward. Your body is telling you clearly that it is rationing resources. That is not something to ignore. Sign number 5, restless legs at night. This is the sign that surprises people most, and it is one of the most underdiagnosed connections in the whole of medicine. Restless leg syndrome, that unbearable creeping, crawling, itching sensation in your legs when you are trying to fall asleep, the one that forces you to move them just to get any relief, has a clear and well-established link to low iron stores in the brain. Iron is needed to produce dopamine, the brain chemical that helps regulate movement. When iron stores drop, dopamine signaling gets disrupted, and the legs start doing something deeply strange at night. I have had patients tell me they have lived with this for 10, 15, even 20 years. They never mentioned it to a doctor because they did not think it was medical. They assumed it was just one of those things. If this is you, please go to your doctor and specifically ask them to check your iron stores. Not just your hemoglobin, your ferritin. Those are different tests, and you need to ask for both. Sign number 6, brain fog, slow thinking, and difficulty concentrating. Your brain accounts for roughly 2% of your body weight. It consumes around 20% of every breath you take. It is the most oxygen-hungry organ in your body. And when oxygen delivery drops, which is exactly what happens when iron is low, your brain feels it early and feels it hard. People describe their thinking as slow. Their memory is slippery. Their ability to focus is weaker than it has ever been. Tasks that used to feel easy now feel like wading through thick mud. What makes this particularly dangerous is how often it gets misdiagnosed. I have seen patients referred for depression, for anxiety, for burnout, when the underlying cause was iron deficiency that a single blood test would have caught. The symptoms overlap almost perfectly. And I want to be honest with you here. Early in my career, I went through a period of feeling mentally flat and slow in a way I could not explain. I was working long shifts, sleeping badly, eating inconsistently. I got my bloods checked. My iron was low, not critically, but low enough to matter. I changed what I was eating. I addressed the deficiency, and within a few weeks, the fog lifted. I tell you that not to make this about me, but because I want you to understand that this is not a weakness. It is a biological problem with a biological solution. Sign number 7, strange cravings, particularly for ice. This is the strangest one on the list. And the first time I came across it in training, I genuinely thought it was a mistake in the textbook. It is called pica, the urge to chew or consume things that are not food. The most common version is ice. Adults who crave it obsessively, chewing through glass after glass throughout the day. Less commonly, chalk, clay, soil, paper. The mechanism is not fully understood, but the link to iron deficiency is consistent and well established in the research. I have seen this in the department. A patient comes in for something unrelated, and during the story they mention, almost apologetically, that they have been craving ice for months. They are embarrassed by it. They think it is a strange habit. Almost every time, the blood results confirm low iron. If you or someone you know has developed an unexplained craving for non-food substances, please take that seriously. It is not a quirk. It is your body sending a signal. The red flag escalation. Now I need to stop and say something clearly, because this matters. Everything I have described so far, the fatigue, the breathlessness, the brain fog, the restless legs, these are signs worth investigating calmly with your GP. But there are symptoms that require you to act immediately. If you are passing blood in your stools, or if your stools have turned dark, tarry, sticky, or black, that could indicate bleeding from higher in the gut. If you are vomiting blood, if you are losing weight, you cannot explain alongside any of the symptoms I have described. These are not book an appointment when you get a chance situations. These are going to A and E today. Iron deficiency in an adult, particularly in men or in postmenopausal women, always has a cause that needs to be found. And sometimes that cause is something serious happening in the gut that needs to be ruled out urgently. I am not telling you this to frighten you. I am telling you this because catching these things early is the entire point of everything I do. The system failure moment. Here is what genuinely frustrates me about all of this. Iron deficiency is not complicated to diagnose. It is not expensive to test for. It is not difficult to treat. And yet patients come through my department having lived with these symptoms for years, sometimes a decade, because nobody ordered the right blood test. Appointments are short. Doctors are stretched. Symptoms get put down to stress or lifestyle or simply getting older. And the ferritin test, the one that actually catches iron deficiency early, does not get ordered unless someone specifically asks for it. That is a system failing its patients, and it should not be that way. Which is why you are going to leave this video knowing exactly what to ask for. Because in a system this stretched, the people who know what questions to ask are the ones who get the answers they need. 2 things I promised you at the start. Here they are. The foods that bring iron back up. There are 2 forms of iron in food, and they behave differently in the body. Heme iron comes from animal sources and is absorbed most efficiently. The best sources are lean, red meat, beef and lamb, particularly liver, sardines, mackerel, mussels, and oysters. Liver in particular is one of the most iron-dense foods on the planet. Non-heme iron comes from plants. Lentils, chickpeas, kidney beans, spinach, kale, and pumpkin seeds are all excellent sources. The absorption rate is lower, but there is a simple trick that dramatically improves it. Eat these foods alongside something rich in vitamin C. Peppers, tomatoes, citrus fruit. Vitamin C significantly boosts non-heme iron absorption. That combination at the same meal makes a real, measurable difference. The flip side, tea, coffee, and calcium, taken at the same time as iron-rich foods, actively block absorption. If you have an iron-rich breakfast, wait at least an hour before your morning coffee. That one change alone can improve how much iron you actually absorb from your food. And please, do not start iron supplementing without getting tested first. Too much iron causes its own serious problems. You need to know your levels before you supplement. The exact test to ask your doctor for by name. When you go to your GP, ask specifically for 3 things. A full blood count. a ferritin level, and a transferrin saturation. Write those down. Say them out loud at the appointment. A full blood count alone will not catch early iron deficiency. The ferritin is the test that shows your stored iron, and it is the one most likely to be missed unless you ask for it directly. If your GP is dismissive or tells you the waiting list is too long, be persistent. You are entitled to these tests. If you have symptoms that concern you, say clearly that you are worried and that you want the right investigation. In a stretched system, the patients who advocate for themselves are the ones who get the care they need. That is not how it should be. But right now, that is how it is. Iron deficiency has been called the world's most common nutritional deficiency for a reason. It is everywhere. It is underdiagnosed. And it is quietly stealing energy, focus, strength, and quality of life from millions of people who have no idea what is causing it. But here's what I need you to hold on to. It is fixable, completely, straightforwardly fixable once it is found. The fatigue that has followed you for months, the breathlessness on the stairs, the fog that makes everything harder than it should be. These are not just life. They are not just age. They are biological problems with biological solutions, and a blood test costing nothing could uncover all of them. Know your signs. Know your numbers. Know what to ask for. Your body's been trying to tell you something. Today you learned how to listen. If this video was useful, please share it, because there is someone in your life who needs this information and doesn't know it yet. And subscribe if you haven't already. It is just me here, building this one video at a time, trying to reach as many people as possible before they end up needing emergency care. That is the whole point of everything I do. I'm Dr. Miles. Thanks for watching.